What's up, everyone? Welcome back to Better Biomed. Folks, we're going to do a walk and talk today, and we're going to talk about HL7. I know there's more exciting things to talk about, but it's a kind of a misconception in our community, and very few people understand how it really works. So, HL7 is health level 7. And I'm not going to go into too much detail, but it's basically a protocol that allows medical devices to talk to each other. And we wouldn't have the healthcare system we have today. These guys all didn't just get together and decide that, hey, this is a pretty good idea. In other words, if you had a Philips monitor and you had some GE monitors, and let's say you wanted to have some space labs in there, or maybe you have a Draeger anesthesia machine, could you fathom all these different manufacturers having all these different types of devices and how they might actually talk to each other? The analogy for humans would be, let's say one guy speaks English, one guy speaks German, the other guy speaks Spanish, and they're all trying to manage the same task. So basically it's a translator, and it's a protocol that allows all these different medical devices to talk to each other. And it was invented in the 80s, and it is the basis behind our EMR, our electronic medical records that we have today. There's several different codes that you guys might recognize. One of them is admit, discharge, or transfer, ADT. There's a few others. But anyway, HL7, invented in the 80s, and it's basically like a translator, a standardized protocol that allows different medical devices to talk to each other. Now, a medical device will normally export a whole bunch of data. And that data has got to be parsed. So imagine like a paragraph full of just word, or number. And one of those numbers is going to be your blood pressure. Another one of those numbers might actually be the patient's age or the bed number. Who knows? But there's a driver that has to be written that allows that device to parse certain numbers for different types of parameters. And those parameters will then get mapped to the EMR, and we have our patient record. So there you have it, folks. That is a rough summary of health level 7, HL7. You'll hear it often, especially when we're talking about health device networking. That's for a good reason. All these devices got to talk to each other. Thanks for watching.